Why children are not affected by coronavirus. Any outbreak of a new illness raises lots of questions. Coronavirus is no different. This novel virus, which has been named SARS-CoV-2, and the disease it causes, named coronavirus disease 2019 and abbreviated as COVID-19, has been on the public health radar for only a few months. First appearing in China in late 2019, the virus has now spread to every continent except Antarctica. Cases and data multiply. Infectious disease experts are starting to be able to draw some fairly solid conclusions about the virus and the coronavirus disease. High on the list of questions that parents have about coronavirus is how it may affect their children. Fortunately, the answer is somewhat reassuring. Danger increases with age according to numbers provided by the China Center for Disease Control and Prevention. Almost 90% of the more than 72,000 coronavirus cases reported in February occurred in people between the ages of 30 and 79. Only 8.1% of the coronavirus cases were teens, and 0.9% were 9 or younger. Similarly, the World Health Organization mission to China found that just under 80% of the cases reported as of Feb. 20 were in people ages 30 to 69. Children infected by the virus also typically have milder symptoms, or none at all, and the death rate among younger patients is much lower than middle-aged and older populations. Thanks for watching. Like, share and subscribe to our channel.